So my name's Liz Baker, I'm Assistant Director for Barnado's, and I manage the ACE Coordinator service on behalf of Early Action Together. We all know we need to do things differently. We're facing increasing challenges and demands with austerity and the current climate for our communities and families in 2018. And an ACE lens basically enables us to recognise the complex issues that families are facing today, such as domestic abuse, substance misuse and parental mental health. The research has shown us that the impact this is having on children and young people's mental health and their development. So when we're looking at children's behaviours, such as criminal behaviour, antisocial behaviour, or them becoming involved in risky behaviours, rather than seeing those children as problematic, we need to understand that they are symptoms of their childhood experiences, whatever they are. So understanding that trauma, if that's what those experiences has led to for that child, and how that has impacted upon their development, means that we can develop more effective targeted interventions, so that we're more effective in the help that we provide to them, and doing that on a strengths-based, holistic, evidence-based approaches means that we're going to be able to support communities more effectively with all of those challenges as well. So the third sector is really experienced in delivering community-based interventions and services. A lot of the time our interventions, our services aren't statutory, which means that people and communities might feel more comfortable engaging with the third sector. And then that means that we can often be more embedded in those communities. So we understand their issues, but also their strengths and how to engage them as well. I think what the third sector also does well is that it often acts as, because of the need for it to require the requirements for the third sector to work in partnership, we often act as a bridge across disciplines, across organisations and across systems. And our understanding of those again enables us to be well placed to develop those services with partners. And if you look at the ACE time delivery that Barnado's is undertaking on behalf of Early Action Together, I think that's a good example of partnership working. So we understand the requirements and the responsibilities of our partners, but we bring an independence that enables that training to be quite challenging but safe for police and partners. We've already been able to see across all of Early Action Together the benefits for individuals in understanding their work through an ACE-informed lens, but also for themselves. So applying that lens to their own experiences and how that affects the way they work. In regards to services, as I've said previously, you're more likely to be delivering targeted interventions that are focused upon the needs of those communities and individuals that you're trying to affect change in, because you understand the trauma or the ACEs that those people have experienced. And then for organisations, if you're putting that ACE lens across the support that you're offering to your workforce, you're more likely to have a healthy and happy workforce, because again you're understanding their experiences and how the interventions that they're delivering are also impacting upon them.